Good afternoon in Miami Beach. This is Dr. John Bennett of Neurosurgical TV. We have the honor of televising a well-known neurosurgical mentor in Iraq, who I've done webcasts with for a couple of years now. He's been very open to the tech. He uses a lot of it, and he has a really good group together here. And he's going to run the show. I'll just introduce him, and he'll take it away. Hello, Samar.
Hello, John.
It's all yours.
Yeah, so thank you, John. Thank you for the introduction. Hello, everybody. First of all, I want to thank the Neurosurgical TV. I have been working with them since 2016, and even a little bit more with a lot of progression together. That's always an international stage available for low and middle income countries. And equally connecting people from around the world. That's what the Neurosurgical TV do, and that's what actually help us to go through the process. So thank you again for the Neurosurgical TV, and now I'm announcing the start of our 2022 neurosurgery online mentorship. Which is the 9th in a row, and we are proud that to start we have more than 120 participants to launch the start of these meetings. I'm really proud of the passion that we have as a group, as a full team, and yeah, we are always welcoming a new member, and we are ready to support new members. That's for me personally, that's a lifestyle, to be a mentor and to support new people every day. This is actually every day. For those who know me closely, they know that this is an everyday task. And just the mentorship, just to make it from time to time more official, more focused. So we make this mentorship, just to give you an idea that after the time that we finish the mentorship, we are all open to make more collaboration to continue what we already start. So welcome everybody, and just I want to put a little introduction and what are the plan for the mentorship in general and for today in specific. So in general, the mentorship, our plan, which will be quite flexible to adapt for your needs and to match the expectation. But the cornerstones will be at least 10 online sessions. Each session include part like this to be recorded on the Neurosurgical TV. This will give us the opportunity to document our work as a mentorship, and for you also as a participant to document your work, because some of the future meetings will include your presentation. That's very good as a start to do a presentation at an international stage like the Neurosurgical TV. So the new thing, this is unique, I think, and for us this is for the first time to do a hybrid session mentorship, hybrid, one recorded live on the Neurosurgical TV for 1 hour, and later 1 or 2 hours, just to have interactive discussion when I can explain more, we can share more patient data, because that part will be more private. So it's more deep in teaching, and also I can interview some of the participants, student, resident, and have their opinion and discussion, because that's an important part. I need to involve you and to take what you have and then make it to the next level. So that's the general idea. 10 sessions, first hour is here, then 1 or 2 hours, it depends, to be offline, let's say. This is number one. Number two, yes, it's in neurosurgery. It's one of the most precious jobs in the world, because you are dealing with the most precious organ, and a few things in life and in the human body that cannot regenerate. One on the top of the list is the brain. That's why we should be very delicate while we are studying, teaching, and even operating. So this is a continuous chain. One depend on the other. First is to develop understanding what's the neurosurgery, then what's the requirement for neurosurgery, how much I should dig in anatomy, then radiology, what's the required part of radiology. I will share many operative video which will be shared for the first time for a real cases and quite challenging cases. After I give, I think for the first few session, I will focus more on anatomy and CT scan basics for you. So it's a process of teaching. Then with the other session, we will be more interactive. Apart from the cases sharing and what we have as an experience, what I have to share with you also, this is for the first time, it's a full English mentorship, because the previous mentorship, the major part will be on Arabic base or mix Anglo-Arabic. So this is a full English mentorship for those with the first year medical student from Arabic country. They are struggle with English. I can put extra time for them at the end just to discuss extra topics. This is just to facilitate things and to accommodate for the audience. And just to mention that, I should mention that if you are interested in spine, just learn about the brain from here, and then you can relate to the spine. I'm not the spine guy. You will not have a good teaching about spine from this stage, just to be honest with you from the start. But what we think is that, okay, not every person of this 130 now attendees will go to neurosurgery. I think to have a broader vision that, yeah, this is a neuro thing, this is a brain thing, because from that we can go to neurosciences. There is a huge interest in neurosciences, and there is a huge cutting edge technologies and inventions that change the world. Everybody want to focus on it. Some people want neuropsychology, some person want to go neurology, then neurosurgery. It depends on what you have in a direction. But I know, what I'm doing now is just to explore through neurosurgery the many subspecialties or specialty behind. This is a part. And the other part is that many of you just starting the medical college have not made a decision right now. The decision should be always informed based on exploring as many specialty as possible. So yeah, what you will see here, you can relate on other branch. And for the future, I believe 100% that everybody of this team will have this experience and this interaction and these team spirits in mind in the future. Whatever the specialty you will be, whatever the institute that you will practice in the future, you will have this in mind. I think one of the most important is to keep passion with your work. Number two, how to do a teamwork. And the third one, to achieve things. Many are just dreamers. We want to have the mix of dreaming and achieving. This is the challenging one, and we'll try to actually to learn it together, and we will try to do it together. For me, that's the general idea of what we will have. If anybody looking specific, what will be the exact program? Simple answer, it's not there. I put it as a number of items that I should go through this mentorship one by one, but it's not in a specific arrangement, let's say, or on specific order. Why? Because I needed a flexible program. Somebody can show, somebody have a technical issue, somebody have any issue that cannot show today. The program should be quite flexible to ensure a full concentrated material. That's from part one. And for part two is that I have a lot of slots that empty now, and they are just ready for you to give your part of the program, because I think with the last meetings, I think 7th, 8th, and 9th meeting will be mainly just as your presentations. That's in general. For any question you have, you can post it here in a Q&A, or I would prefer just write it down with you, because we have a session for a Q&A at the end after conclusion of all the today topics. So what we will do next is we will have a presentation from Tiba, which is a medical student from Iraq, about the application that you made and your motivation letter. We already have an extra step. We just analyze your application to this mentorship and make it as an research, just to give you an idea about how the importance of data is. The second presentation will be from Zara Amin. She's also a medical student from Iraq. She will present an interesting case with a lot of philosophy that I want to comment on. And we may have let's say a mystery guest at the end. And we will end by one or two items. One from Hajar, which is a medical student, who will share she will share with us her experience from the last mentorship and what she did through art. And there is a potential meeting with one of my mentors from Saudi Arabia. We are trying to make this meeting happen at the last minutes of this 1 hour. That's the schedule for this 1 hour. After that, we will end the session at the Neurosurgical TV. I will send a new link at the Telegram group. Then we will go inside to discuss more deep in neurosurgery. So we can share this. We can start now, and let's start with Tiba. For all the presenter, please try to be direct, focused, and catch up with the time required. So yeah, you can share, Tiba, please.
Okay, doctor. Can you hear me okay?
Yeah.
Yes.
Well, I'll start then. Hello, everyone. I am Tiba Al-Ajili. I'm a fifth-year medical student in the University of Baghdad, Iraq. And I will talk to you a little bit about first impressions in academic applications, as Dr. Hoz just explained to you.
Try to make it full screen, yes, please, Tiba.
I'm sorry. Okay. Can you see it now?
Yes.
Okay. So again, I'm Tiba Al-Ajili. I'm a fifth-year medical student in the University of Baghdad, and we'll be talking about first impressions and how important they are in academic applications. But first of all, I'll tell you a little bit about myself to know me properly. As I said, I'm a fifth-year medical student. I'm interested in clinical medicine, interested in surgical practices, specifically neurosurgery being the top one. I've attended the 8th Hoz Neurosurgery Mentorship, and I've had wonderful experiences ever since, ranging from surgical skills, neurosurgical simulations, and neurosurgical skills, attended many operations, and even assisted in a few, which was very limited, but it gave a higher sense of confidence and being part of the team. And it was a very surreal experience. I've also had few contributions to the research part of the mentorship program, which was in the final few weeks. So a few weeks from now, I have contributed in about 10 research projects, which to me is a very much an achievement in this little time. And I'm hoping for more in the future. I'm also a part of the Dandy Club, Dandy Neurosurgical Club. And I've had the opportunity to be in the Dandy Pan-Arab meeting in Beirut in March of this year. And I went there with Dr. Hoz and the team from past mentorship programs. And it was a very surreal experience as a whole. Here you have Dr. Hoz's presentation, in which he surprised us with the slides of our experience in his mentorship. And here I stood up. He just called me out and stood up in front of the crowd. And it was very surreal to see people of similar interest applauding you for things that could be considered minimal, but are very important and near and dear to your heart as a medical student. So it was a very happy moment. Also, we've met amazing neurosurgeons. We've heard their stories, got very inspired, and I made friends that we're still friends till now. And I loved everything about this trip that I wanted to talk to you a little bit about as well. Now I'll stop talking about myself and tell you a little bit about our subject of the day, which is the importance of first impressions and what do they mean in academic applications. So what I mean is when we apply for something, let it be a program, a course, maybe we're presenting our CV for a certain job. We have to think in mind that this application will perceive a first impression that differs greatly according to the receiving end. So whoever is seeing your application, so it differs from the perspective. Let's say you have a big CV. It's filled with very multiple operation attendants of very variable specialties. You have many research contributions, also a variable specialties, let's say neurosurgery, gynecology, pediatrics, and so on. And you've listed all the conferences you've attended and such things. So it's a very long and very full CV. And if a medical student is the perspective we're talking about, they will be very impressed by your CV. They'll be very even jealous. But as a whole, they will have a very positive impact on them and will motivate them to be like you. And the first impression is very positive, as we can imagine. But let's say a neurosurgeon saw this same CV, the reaction would be a little different, as it shows a little bit of disorientation. It shows a little bit of variability in such things that is not very helpful, because you want to focus on things that interest this perspective of neurosurgeon. So you list the things that are related to neurosurgery, you list the things that are related to your operative experience or whatever it is. And you have to make yourself stand out in your application, because chances are there are multiple people who are applying for the same thing, and you want to be deserving of that position you're applying to, whatever it is. As we know, this mentorship was this new mentorship, the application for it was by sending a motivational letter or motivational email, and every one of the participants did so. And the thing is, even though they varied greatly, they're very different from each other. There is they are not the same. No two applications are the same in any way. Yet we could, Dr. Hoz and the team for the planning of the mentorship could see that there are common goals based on the things that you could read through the application forms. These goals range from observation and just looking what's happening and seeing what's neurosurgery as a whole, mentorship and mentorship aspects and having a mentor and how important it is, connections and networking with other people and international meetings and so on. Also, we have research opportunities, people who want to build their CVs, people who want to increase their knowledge, and of course, neurosurgical orientation for people who are decided on neurosurgery as a future career or want to make an informed decision and if they should pursue it or not. Regardless, your applications, even they varied very greatly, as I said. They all had their strengths and they had their weaknesses, but we all are learning along the way, and this is also a learning experience. So what I want to tell you is that in future applications, at least put your mind in the you want to have a checklist so you can apply to certain things in the future, whatever they are. As I said, could be courses, could be CVs or whatever, but you have to first introduce yourself, in which you want to say your name, and not only your name, you want to say what stage you are in, if you're in medical school, if you're a resident, if you're an intern, what university do you go to, what hospital do you work in, and so on. And also you want to tell the country and such things. This goes a long way, more than you can actually imagine. Number two is you want to be straightforward and concise. So maybe you want to tell the application, you want to write in the application that you are very passionate about neurosurgery from a young age and you want to tell a personal story. Make it short. Don't go into detail and write a whole paragraph about it. You can sum it up in 2 lines that could reach the reader better and actually give them an idea that you are a practical person and you are also passionate. So this is also a second thing that you have to put in mind. Third thing is, of course, you need to show interest. Why do you want to join this course? Why do you want to join this program? What do you think you could benefit from? What do you think you could improve in yourself, and so on? And number 4 is to maintain a good attitude throughout the whole message from the start to finish. Stay away from ego. It's not good for you, trust me. And after that, that all being said, I want to say that the applications, of course, Dr. Hoz and the team know that they varied very, very much, and they had their strengths and weaknesses, as we stated. Yet there were a few applications that really stood out, which is the thing that we are looking for in applications. You have to make it stand out, in which you will be perceived as you have something special. And so we have 5 top applications today that were decided by Dr. Hoz and the planning team. And I'll list them now and read their applications to you as well, so we can all benefit from it for the future. In the 5th place, we have Hussein Mohsin, who is a medical student from Baghdad, Iraq. He's a 5th year medical student. He has introduced himself. And as you can see, his letter is concise. He included his interest. He included why he thinks that this program would help him. And he also maintained good attitude throughout the message. I think this is a very beautiful application. So thank you, Hussein, and we hope to see you in future projects. 4th place is Mohammed Saad. So what Mohammed did was very different from many applications that we've seen. He inserted a few lines that I would love to read to you so you can experience them with us. There's a saying that goes, do your best. One day you will become someone's hero. And to be more precise, that someone is going to be me, and my best involves taking the, and my best involves taking the right choices, and I'm certain being a part of Hoz Neurosurgery program will definitely be one of the best choices for me, and I'll be very proud to take part of it. And at the end, he said, wherever the art of medicine is loved, there's also a love for humanity, which is the same by Hippocrates. And this is very beautiful because it points and shed lights on the aspect that medicine is not all about learning and success and all of those things. We have to keep in mind that we're not looking at cases, we're looking at patients who are people, and we want to help them and we want to save them their lives and such things. So thank you, Mohammed, for shedding a light on such an important topic. 3rd place is Nicola. Nicola is a final year medical student from Italy, and he is very interested in pursuing neurosurgery as a future career. He likes research. He also has done relation to neurosurgery, which made his application very special. So thank you so much, Nicola, and we hope to see you also in future projects. 2nd place is by Arwa. If you know Arwa, you can see that her application is very beautifully put. She has a very good presentation of herself. She has her personal information listed. She talked a little bit about her passion and the story for that passion in very minimal words, which was concise and beautiful. She also told a little bit about what she thinks she would join this mentorship would help her. And she maintained good attitude and such things. So thank you, Arwa. And 1st place goes to Kainde Alari. And I'm very sorry if I'm pronouncing your names incorrectly. I hope you correct me in the future. But I'll read this one because it's the last one and it's the 1st place. So it's very important. Mentorship goes a long way in helping other young minds with the actualization of their dreams and fulfillment of their heart desires. Mentorship to me is very crucial at this stage of my medical career. It's important in helping me navigate through this ocean of medical fields. I'm a 5th year medical student from Nigeria who developed interest in neurosurgery. I'm taking this mentorship program to develop some research skills, clinical acumen, neurosurgical management skills, patient interaction skills, public speaking skills, and also to learn from mentors on some important facts about neurosurgical practice. With this mentorship program, I believe I'll be able to improve my knowledge and skills on the basis of neurosurgery in various sections through the mentorship program. And he listed all the things that he could benefit from this mentorship. And he also maintained a good attitude and a beautiful writing style. So thank you so much for this beautiful application. The top applications as they are very special, I think Dr. Hoz will tell you that they're going to have a few rewards as, rewards for being in the top, but we'll talk a little bit more about that later. And to end it, I would like to say words are free. It's how you use them that may cost you. And we've seen that as examples and things that we've told throughout this presentation, I hope. And thank you for your time. I hope you really benefited from this and you could use it in the future in any way or form or any application that you may have. And that's it. Thank you for this opportunity and thank you for Neurosurgical TV for having me today.
Thank you, Taiba, for this nice presentation.
Thank you.
Actually, I totally agree with you with all the point. We have a discussion for that before. I want this to be recorded and maybe reviewed later for those who want to apply anywhere, because to be on the other side of the to see the application from the receiving side, it's a total different experience. And yeah, for those who get the top 5 applications, actually we choose only from medical student. We have also a couple of residents and doctors, but we think that this is just should be aged match. So for medical student, we choose the best 5 application, and I think we will give them a certificate for this little, but it's a good achievement to start with, to have one of the top applicant at day one. And also I will involve them with a few let's say bonuses in the future. And so congratulations for them. I thank you, Taiba, again. I will start right away with Zara Amin presentation. Zara, she's a medical student from Iraq. She's very, very brilliant. She's now in the 6th year, and she's, I think, from mentorship number 6 or 7. And at the end of her talk, there will be a special guest also related to her talk. So please focus with us. And yeah, the stage is yours, Zahra.
Hi everyone, I'm Zahra. Let's start sharing our case. Could you please tell me if you can see it, the presentation?
Yes.
Okay, let's start. Hi everyone, I'm Zara Amin al-Sbayhawi, a 6th year medical student. I will present for you today a case about of parietal atretic fallacy. Firstly, let's have a quick review about fallacies, true fallacies first. Encephalitis results from failure of surface ectoderm to separate from neuroectoderm. In simple words, there is a bony defect that allows a meninges and the neural tissue to herniate from it. Occiput is the most common site in this type of neural tube defect. So, atretic cephaloceles is thought to be an involuted type of this true cephaloceles. It's actually very rare lesions, account for 1% nearly of ulceroprospinal congenital malformation. So why parietal in specific, parietal atretic cephaloceles? These lesions have distinct frequent association with complex and various venous anomalies that mask all its presentation, management, and prognosis, of course. Our leading case was a 25 years old male who presented with a painless scalp defect, painless scalp bulge that firstly noticed when he was 4 years old and stayed the same shape and size from then. Our patient was a healthy, wealthy, without any complaint, just has certain concerns, cosmetic concerns actually. After examination, we did CT and MRI for him that revealed a bony defect in the middle of the scalp with a herniated neural tissue. Actually is heterogeneous cystic lesion occupying the defect. But in CT scan, in this axial section of CT scan, we found such an interesting finding of this round opacity here in the parietal lobe, near the parietal lobe, as you can see. MRV reveals fenestration of superior sagittal sinus by an enlarged vessel, cortical vessel, arising from the sylvian fissure ending in the site of filling defect in the superior sagittal sinus, as you can see here. At this point, we reached two differential diagnoses actually. This is an obvious venous malformation. We have type 1 dural arteriovenous fistula and atretic fallacy. But for the second differential, it is unlikely to associate with such venous anomaly. We hadn't heard of this to be reported before. And this is the cortical vein. It's an enlarged vein of Trollard, as you can see here, from the sylvian ending in the superior sagittal sinus here, in the middle curve of the superior sagittal sinus. So we did a digital subtraction tomography to confirm our diagnosis of atretic cephalocele with this unique venous malformation. Unique venous malformation. Our case has atretic parietal cephalocele with enlarged vein of Trollard and fenestration of superior sagittal sinus. After searching in English literature, we found that our case was the first reported case that have this kind of venous association with atretic cephaloceles. Actually, the most common associated venous anomaly is fenestration of superior sagittal sinus. Just fenestration of superior sagittal sinus. As a management of atretic parietal cephaloceles, it's actually a benign lesion. Surgical indications only when for cosmetic purposes or to alleviate pain that result from traction of the meninges, or a modifier in the lesion that increasing in size, changing build nature and the nature of the lesion suggests its intracranial communication. So we prefer to surgically remove the lesion. Our patient had chose conservative management, but although prognostic significance of these venous malformations need multi-center outcome-oriented studies are required more to know about the prognosis of these associated venous anomalies. In conclusion, although it is a benign in nature, atretic parietal cephaloceles are a marker of presence of complex venous malformation. So we have to do precise preoperative imaging for the superficial and deep venous system to guide our surgical management or our management in general. If you are interested, you can read the full article here in SNI. We also have presented the same case in Dandiban Arab meeting in March this year. Thank you for your listening.
Thank you, Zara. It was concise, rapid, and focused presentation for actually a difficult to describe case. Thank you for your presentation first. And what I want to comment here, and I think Zara Amin knows about that this case was very challenging because the presentation is simple, and however, the patient has been told that this is a huge vascular malformation of the brain and there is a risk of hemorrhage at any time. So to have the decision that this is a benign association and no surgery required, no intervention required, it's as a huge decision as doing surgery. For me as a surgeon, if you think like, and when you are in my shoes and you are thinking that, okay, I'm a surgeon, I will tell the patient, go home, you don't need any intervention and you will be safe. That's a huge surgical decision. The decision when not to operate is equal to decision when to operate. Actually, this is not totally correct. It's quite more difficult than when to operate. So this is one of the examples, and I will have something to describe about this case more. but what I have today that for this patient, I don't know if Ali can hear us. Ali, are you there? I will talk a little bit in Arabic. Excuse me, because the patient is there and we are happy to share his experience with us. Ali, تسمعني؟ مرحبا علي.
مرحبا دكتور، شلونك؟
أهلا وسهلا. I will translate this later for you, but I will
Okay.
ask I will ask Ali first 2 questions and then I will translate. علي نقدر نحكي علي براحتنا. أول شيء شكرا لوجودك هنا، احنا فرحانين انه انت موجود. اتوقع علاقتنا احنا فعليا كعائله اكثر كاهل صرنا
اكيد
بعد ما مرينا بهاي المحنه. عندي سؤالين. الاول، شنو كان شعورك انت وعائلتك من قالوا لك عندك فد شيء بالدماغ وممكن ينفجر باي دقيقه؟
مرحبا جميعا. اول شيء شيء ثاني، حرفيا دكتور سامر انه يعني خرب كل شيء، يعني خاصه كاني مثلا يعني دخلني بحاله نفسيه مده 2 سنين انا ما اقدر انام. الشيء الاخ يعني اني كنت اداوم يعني بارقى مكان كموضوع انه انا كنت سوبرفايزر يعني باكبر اوبريشن بالعراق يخص موضوع الطائرات، كلش ناجح بهذا الشغل. واصل مرحله انه 7 شهادات طيران عندي من كل دوله، المانيا، دبي، مصر، كل لحظه هاي كل شيء خرب يعني. he destroyed everything in my life. ف يعني خرب حياتي بين قوسين. فبعد قلت لك انه بعد خلاني اخسر اصدقاء، خلاني اخسر علاقتي بعائلتي، لانه كنت دائما انه نرفز انه اي واحد يحكي وياي، يعني دائما اتذكر الطبيب، خاصه لما والدتي كانت تحكي للطبيب فقال لها انه تساله انه هذا الشيء خطير لو مو خطير، فدائما انه الطبيب حكى ببالي هاي الكلمه بعمري ما راح انساها، فقال انه يعني لا تخبصوني، هذا الشيء مو سهل، شيء معقد، أوردة طابة بالشرايين والشرايين طابة بالأوردة، يحتاج لعملية كلش كبيرة. بذاك الوقت إنه أنا فقدت كل شيء، يعني صراحة لحد الآن أنا هاي اللحظة أبد ما أنساها. فالحمد لله إنه بعد هاي الأيام، بعد إنه ما رب العالمين تعرفت عليك، طمنتني، آمنت يعني برب العالمين إنه يعني شنو الشيء راح يصيبنا، خلاص راح يصيبنا الحمد لله والشكر على كل حال. فالحمد لله رجعت انه اعيد حياتي مثل الاول، بس لحد الان بعد مرور 3 سنوات او 6 ما اعرف، انه استرجع شوي بس انه بعد هذا الشيء مثل بيه. فالحمد لله يعني لحد الان الحمد لله.
تسترجع يعني قصدك انه من الحاله النفسيه اللي صاحبه المرض، يعني انه الضغط النفسي خلينا نقول.
نعم لحد الان.
زين. يعني مقدر تماما كل شيء مريت به طبعا. تقدر تقول هسه انت شنو وضعك؟ هسه انت شنو بدك تشتغل؟
دكتور العفو، اني حكيت ويا الطبيب اللي عايني، قلت له اني من جيت للدنيا لحد الان ما اعاني من اي شيء، الحمد لله صحتي تمام، ما في يوم يعني انا احسد الناس مرات يقولون راسي يوجعني، انا ما عندي وجع براسي الحمد لله، يعني حالتي طبيعيه الف الحمد لله والشكر، لحد الان انه انا طبيعي ما عندي اي شيء. فحاليا انا اشتغل يعني رجعت كسوبرفايزر باقوى شركه يعني، والحمد لله انه انا يعني واحد من اهم الموجودين بالعراق بمجال الطيران.
سوبرفايزر ان ويتش ديبارتمنت؟ يعني افيشن سوبرفايزر،
كاوبريشن ايرلاين، يس كاوبريشن ايرلاينز. فتعرف انه انت يعني اير كندا، اير فرانس، يعني هواي ايرلاينات انه اني اوبريشن عليها، فالحمد لله يعني ما عندي اي مشكله.
وضحت الفكرة. يعني أنت فاهم أصلا قصدنا بهذا المشاركة هاي الحالة، لأن الناس ما تتخيل، الناس لازم توصل الفكرة معاناة المريض من جهة أنه شنو اللي هو يحس به وحده. هذا بقدر أهمية العلاج المباشر. يعني كلش فرحان وكلش فخور انه
حبيبي.
انت زين وشغلك ممتاز،
الحمد لله.
فعليا فخر انه
انت فخر لنا حبيبي.
كل
وصراحه يعني اسف اذا اقاطعك، بس يا العراق على هيك انسان، يعني الله يوفقك.
الله يحفظك. شكرا جزيلا، شكرا لوقتك، وسلامي للوالدة ايضا.
Yes, thank you for all and nice to meet you for all. Thank you. Bye.
Thank you. Bye bye. So sorry, that's part that's totally mandatory. I'm sharing this with the student, with the resident, with doctors, and this is the huge part of neurosurgery. If I want to translate this in lines, for those who cannot understand the Arabic totally, which is, I think, 30% of this mentorship, is that the patient said that once he met the first doctor, he described him that he has a complex vascular malformation that requires surgery, and that require very complex and difficult surgery. This affect his life. Before that, he was only have headache from time to time and small bulge in the head from age 4. So he was 25 and he spent 2 years without sleep, and he quit his job initially as a manager and part of the aviation industry, and this is affecting his life, obviously, as he described, and as you can imagine from his even speech tone. And the second question is that, how's your status now? He said that he's very good. He has nothing related to medical conditions, and he's now supervisor in the operation category of in the aviation industry in Iraq, and he's one of the few in this category, and he's performing very well. So that's basically end of the translation, let's say. But yeah, I will have more of your opinion about this, more to elaborate about this in the offline hour of our today's session. But yeah, this is what I want you to see, because now you have the full picture, you have the presentation, you have the basics presented by Zara Amin, then you have the case from a medical point of view, then from a research point of view, then the patient, and this will give you the full idea where you will be tested within the neurosurgery, which part is the more challenging, which part that I should work in more. I think all parts are required more work. Patient-wise, dealing with the patient is a huge importance. At the same time, the scientific basics and the researcher mind will save some patient's life. I think that's decision for this patient is very difficult for me. I require international consultation. I did a consultation with Dr. Zara Sensor, which is an interventional neuroradiologist from Turkey, and also with Dr. Hossam Jehani. He's an interventional and open vascular neurosurgeon from KSA, from Dammam. I emailed them both at the same time and have their opinion. It's not a simple case. Let's do a diagnostic angio, and we end with the common decision that, yeah, this case should be conservative, no treatment required, and there is no risk for the patient. This is huge. And if you notice that when Zara Amin shared this publication, the publication was a co-authoring with Dr. Sarah and with Dr. Hossam. And that's the interesting part, that because they say to me that this is an interesting case, keep us updated about what will happen with the patient. And I think now with the patient voice also and his feedback, I think now the full story is there, and from full story you can learn a lot. And that's it. I don't know if Dr. Hassam is there or not. I will check before we start. And thank you, Zara Amin, for that part. Because I know you are a 6th year and you have an exam maybe.
Hassan Mohammed.
Dr. Hassam Jihani. No.
No.
I think if he is there, he will told us. Maybe next meeting we will have him. And yeah, if you are ready, we have Hajar now. And I think we have like 10 minutes for the presentation. After that, I can conclude this session. Then we go to the interactive discussion session.
Hello, everyone. Is my screen clear,
Hello,
Dr. Samar?
Yeah.
Hello, everyone. I am Hajar Ala Al-Jabouri, 4th stage medical student at University of Baghdad from Hoz Neurosurgery Mentorship, and I have interest in neurosurgery 2 years ago. My presentation today about the neurosurgery and art. I will tell you a brief story about my journey and how we are trying to link between our art-wise and research field. First of all, I am not an artist. I just draw something that came in my mind until one day Dr. Samer asked in the group if anyone can do a small sketch about some article. Actually, in myself, I had a lot of doubt because I didn't make this before. But fortunately, I really hate losing chances, so I quickly sent to Dr. Samer. Yes, Dr. Me. He told me about the details of the article and details of the sketch. And this was the first sketch in the journey of neurosurgery. I really didn't expect how it will be like and how Dr. Samer will love it. And this sketch was published in the article of the orbitofrontal artery in the SNI journal. I really want to conduct my feelings in that day. It was the first publication in my life in the 2nd stage. After that, I got the chance to draw this drawing about the stent devices for the chapter in the neurosurgery book. And after approximately 1 year, the chapter published, and this was the first book for me in the journey of neurosurgery. Really moment of brightness and big opportunity for me in the 3rd stage to publish a neurosurgery book. After that, I did some sketches just to increase the quality and level of my drawings. And now I think your feelings is every sketch just take a few hours to finish, but behind the scene I will show you what happened and how big is the discussion before each sketch, how big is the time and effort. I will show you 3 examples about my most challenging drawing because I did it in the period of my last final and I really feel proud whenever I see it. The first one, 2 months ago, we had to draw a small sketch about the pre-sigmoid approach. Unfortunately, the sketch for this article isn't clear in the Google pictures, and we had to rely on our imaginations and cadaveric videos just. Dr. Samer did a meeting with me and discussed about the topic in the cadaveric videos that he did in the lab and sent me the files about the topic to read. After that, I did a small lecture for me just to study the topic and know all details about it. In myself, I had a lot of doubt about this because it was very difficult and challenged to conduct a real picture into a small sketch. This was the initial draft. It had a lot of mistakes and a lot of edits. We did, I think 30 discussion about this. And the first edit was to remove the retractor and magnify the last two pictures and correct the mistakes and arrange the pictures. And finally, this was the final draft for this. So now it's the time to conduct this picture into real sketch. And this was the result. It's okay for the first try, but still not okay for to be perfect and professional. So we conduct into more professional, and this was the final result. Just see the difference between the first one and the last one. As I said, there was 30 discussion between these two pictures, and I don't know how to say, but this sketch didn't use in the article at the end, but they relied on the radiological pictures and something like that. So your priority shouldn't be always success. Your priority should be how to learn from the opportunity and how to adapt with the conditions like that. This is a small sketch about the Cross of Helix. It didn't take a lot of time. The idea is just when you draw an arch from the cross of the ear, you will encounter the anterior border of the sigmoid sinus. The challenge in this drawing is how you will put the position of the sigmoid sinus to conduct a precise idea about the topic. And this was the article for it. Now I have some pictures just to see the difference between the first and last picture. This was about the classification, more classification about the intracranial stenosis. This was the initial draft, and after 9 edits, this was the final one. And this was the article and big achievements for me. Finally, I want to show you this sketch about the Eustachian tube and salpingopharyngeal. Just see the difference between these two pictures. There is a lot of maze here in the picture. You cannot focus on the topic that you will talk about. And after 3 edits approximately, this was the final results. How art improves my scientific wise. Behind each sketch, I have to study a lot about the topic to be more concise, to be more precise in the drawing. So this, I think, obligated me to study more about the topics and know all details about it. Furthermore, the publication that I had in the short period, really in one year, I had one published article and 1 chapter, and these submitted articles. And the most proudest part is this, when someone, Dr. Big like this, consider you in this message, it's really big achievement for me. And finally, I want to thank Dr. Samer Hoz because he was with me in every slide you see and guide me a lot in this journey. And without him, I really don't do anything. So thank you, Dr. Samer, for your endless opportunities. And thank you all for your listening. I hope you enjoyed my presentation, and thanks Neurosurgical TV for these opportunities.
Thank you, Hajar. It's interesting, and we can listen to your passion through your tone of voice, and that's very nice. I think we have some questions, but I will put these questions for the next session for discussion. We can discuss all the talks with the participant from the mentorship, and because I think now we are perfectly in time. And yeah, thank you for all participants. I will conclude at this moment, just to keep it straight, that this 1 hour will be available on the Neurosurgical TV. Thank you for them for that. And I will send the link and then Telegram group for the mentorship now, and we will rejoin in 5 minutes. Just have a sip of water and change your coffee and then join us. We will spend, I think, 60 minutes more just discussing a few more topics about neurosurgery, but in a rather more deep aspects. Thank you, everybody. Thank you, John, for having us. And I think tomorrow we will have a separate meeting with the Surgical Neurology International, and I will invite you all to be there. And on Tuesday we will be here to attend the next session of studying neurosurgery. So thank you, everybody, and see you soon. Thank you, John.